guys, it's Ryan with Fluid Health. Today I'm showing you how to do a sideline 90-90 pullback. This is a hip traction drill. So really what we're doing is reorganizing the femur glide within the socket of the hip. Most of the time our hips have a tendency to drop down inferiorly. Remember, when that goes down, the socket orientation is rotated externally and posteriorly, and that lifts the femur basically away from the center of gravity as it orients the femur with the socket. It has a tendency to want to rotate in against that to bring it back into the center, and that can create some scouring at that socket, some impingement cycles, some irritation, and then the body wants to offload it because of it. So it'll turn off the glute muscles or the load-bearing muscles that want to load it if it feels it's vulnerable. So it goes into an anti-gravity offloading. So what we want to do is position that ball back in the pocket, get it firmly oriented where it belongs, and then allow the muscles to then go back to their neutral orientation as they're no longer trying to splint and protect. So the setup is key for this one. I'm going to do this with a balloon, so we're going to be using, again, more intra-abdominal tension or pressure to help to stabilize the hip. And I've got a ball that I'm going to wedge between my femurs as a fulcrum, basically, so that when I bring my hips up into a 90-degree angle, and notice that they're pretty tight here, my chest is close to my knee, so it's a deep 90+ degree, maybe up to 115 knee flexion, or excuse me, hip flexion. Knees are at 90, both feet are on the wall, so I'm perpendicular, spine to wall, parallel with the femur to the wall, and I'm tucked under, so I have a partial spinal flexion. And I'm going to facilitate that tuck under with a pullback on my hamstring against this wall and a pushing into the wall to use my glutes. So my glute's going to pull under, I'm going to pull back on my heel, that's going to pull under my hip, and I'm going to be breathing out into this balloon, actively engaging my abdominals and specifically my TVA, and that also is going to pull my hip under. So it means my hip bone here, my ASIS, will proximate to my 7th rib and crunch down, so it's going to create some spinal flexion. Once I know that that hip is properly anchored under and in, then I'm going to wedge that femur down against the ball. The femoral head will glide back into the pocket. It's going to help to organize that femur back into the congruency of that surface. So once again, the setup's fairly critical here. You got to make sure that the angles are correct so that the wedging is correct. So make sure you got a partial spinal flexion, make sure it's 90+. Make sure that you hit all those abdominals, glutes, hammies, and groin to keep the hip under, and then finally wedge. So it's a 6-second breath out. Get to the very bottom of the breath, squeeze your pelvic floor, push your heel into the wall to squeeze your butt, pull back on your heel to hit your hamstring, and then at the very end, squeeze your knee down. Now remember, all the air is out when you do that. Once you get to that knee glide in, hold everything tensed, breathe in. Expand your thorax without losing any abdominal tension, so you get thoracic excursion. Again, intra-abdominal pressure and no movement. You're controlling the hip against the pressure of the knee glide, again, pushing that femur back and controlling the breath cycle. So I use a balloon to do that, so I get more tension on the ab wall as I breathe out. And again, it's breathing out for 6, holding for 2, and then breathing in for 2 through the mouth and setting over the cycle. So here it goes. So as I'm breathing all the air out, I'm squeezing my butt, squeezing my pelvic floor, pushing my heel, and pulling back, and then squeezing in. At the bottom of the breath, pinch it off, hold everything tensed, don't let go of any of the muscles, and then breathe in through the nose and inflate your canister without losing any of the pressure or tension in the muscle. If you do, you're going to feel your back expand posteriorly, and then you're going to reset and do it again. Notice I'm supporting my head in my right hand. This is the affected side, left side up. Once again, as I'm breathing all the air out, evacuating all the air from my lungs. I shouldn't be able to talk at the bottom. Obviously, the balloon's in your mouth, so you shouldn't. But again, you can't talk. It's all the air out. Squeeze your pelvic floor, squeeze your butt, pull back on the heel for your hamstring, and then squeeze the knee in. And what's that again going to do is provide the proper fixation for the region so that the glide of the femur in the socket is properly positioned, and then the nervous system accepts that new standard, and then you'll have more loading potential as the body doesn't guard and want to get off of it. So this is a really important drill for hip stability for most of us. So this is going to be a repositioner or again, a self-distraction mobilization of the region so that you can get better neuromuscular efficiency for weight bearing or stance side mechanics on the left side and or right side, depending upon where the issue is. So questions on any of this, reach out, admin@fluidhealthandfitness.com, but get after it.